Hey everyone, this is Reggie from Bristol Plus Physical Therapy. In over the last several weeks, last several videos, I've been discussing the shoulder pain related to swimming. Right, I answered a few questions um, related to shoulder pain and swimming. Right now, in this video, in today's tip of the day, I want to answer one question that I got asked by a swimmer. Okay, because here's the thing: when you're doing swimming, swimming is very good for the body. For most of the joints, swimming is really good. It doesn't have really a lot of impact. The one joint that I would say, which is commonly irritated, commonly injured for swimmers, I would say will be the shoulder, right? So because swimming involves a lot of arm movements, a lot of shoulder movements. You can do the butterfly, right? Freestyle, backstroke, a lot of repetitive movement on the shoulder. And when you have overhead and you have repetitive movement, those are two things that easily irritates the shoulder. And that's why they have this condition called or termed swimmer shoulder. So there's a condition they call the swimmer shoulder because then you have inflammation in the shoulder because of the form that you have during swimming. So some of the structures there in the shoulder involved, some tendons there inflamed because of the repetitive nature of the sport. All right. So now I got asked this question is, so what are some exercises that are good for swimmer shoulder? So in this video, I want to share with you the top 3 stretches that are good for a swimmer shoulder to prevent it, or when you're having that pain. I want you to do these also to help at least get that pain down. But if you're having that pain, I wouldn't really just recommend doing swimming. So I mentioned that in some of my videos before. Definitely seek an expert, a specialist who can help you get rid of that pain so you can safely go back into sport. Okay? Now, let me get back to the to that question is what are the top 3 stretches that I would recommend for a swimmer shoulder? So number 1 is a pectoral stretch. Okay, so we want this open up, and even some of my patients who have shoulder issues, we want this to open up because when you're doing this, it impinges the rotator cuff tendon even more. Okay, and I explained that in one of my videos before. So the pec stretch. So you can do a couple ways. One simple way is you can actually go like this if you're stretching one side, okay? Or if you want to do both sides at the same time, you can actually go on the door frame like this, go up, okay, kind of lunge in, okay, it will stretch both at the same time. So if I'm facing you, so it's kind of like this. Let's say you have the door frame here, and then you're actually stretching this way. Okay, it's opening up both sides. I like to do that because I feel more even when I do it at the same time. Also, it saves me time, okay, compared to one at a time. But if you're having, let's say, shoulder pains only on one side, the therapist might actually focus on that side first, but you can do it for both, okay? But if it's, let's say, for just preventative, I want you to do both at the same time, okay? So that's the pectoral stretch. Second one is what we call an external rotation stretch. So external rotation is the arm moving out this way, okay? So that stretch is, again, a wall or a door frame, okay? Put your palm facing it like this, keep your elbow in, and then I want you to turn your body out, and I don't want you to create space here, okay? So this way, and then you turn out. So basically, it's forcing your arm to go this way, okay? So do it at this angle, and then you're stretching, you'll feel the stretch on the shoulder. This will help you get more external rotation. Do it on the other side. This one, I would recommend doing one at a time, okay? So you want to stretch your going into an external rotation also. And the third one is I want you to mobilize your thoracic spine because there's a lot of movement like this when you're doing swimming. All right, you want your thoracic spine to not be too tight, to be flexible. And how do you do that? We can use one of these things. It's called a foam roller, okay? So you can go back like this. You can do it against the wall, or you can do it on the floor also, okay? Floor might be easier for you if when you put the weight on the foam roller, it doesn't hurt. Might be easier because you can lie down. You can just use gravity to pull you back. But if, let's say in standing or sitting like this, put it like in the shoulder blade area there, mid-back. Put your arms out like this, and then just go backwards. So extend backwards. This will open up the front, and also it helps you extend your thoracic spine, okay? So if from here, going this way, so this is what you're trying to do. And you can actually move it even lower, okay? And then go up, okay? And then lower again, and then go up, okay? So you have the length of the thoracic spine there, okay? That's what I would want you to try, and try to get more mobility on your thoracic spine. So those are the top 3 stretches that I would recommend when you have a swimmer's shoulder or to prevent swimmer's shoulder. Again, to recap, there's number 1, you do a pectoral stretch. 2, external rotation stretch. 3, improve your thoracic spine mobility. Okay? Try those, especially if you're a swimmer. I want you to try this. If you know anybody who's a swimmer, who's recovering from a shoulder injury, or you want to prevent that, you want to keep them safe, especially the young, like the teenagers, your kids or your grandkids, please share this with them. This will help them be safe. It'll help them be able to perform without risking having some shoulder problems, because I've seen that in the clinic, especially with younger people, with the teenagers. Their body's not as strong yet, and when they try to compete, they keep practicing and they injure themselves. All right, so please share this with them so that they can help them avoid injury, help them stay pain-free, or if they have an injury, help them recover from that injury. All right, but if they need help, or you're actually experiencing it, you need help, feel free to reach out to us. You reach out to us by phone, DM, or email. Or you can look at some of the videos I shared before in our YouTube channel and social media. Hopefully those will be able to help you out. All right, thank you very much for your time. I really appreciate you watching this video, and remember, I need you to like, comment, subscribe, and share this video so you can help transform other people's lives. You can help keep other people pain-free and keep other people healthy. And let me know what you want me to answer, what you want me to discuss in the next video, so that I can share my knowledge and I can help you stay healthy and pain-free also. I'll see you in the next video.